Hi guys, it's Nadia here. So I'm one of our remedial massage therapists at Scarborough Physio and Health. Just going to chat to you today about manual lymph drainage, or MLD. It's one of the things that we offer here at Scarborough, and I've just noticed a lot of people probably don't know a great deal about it or what it does. So I'm going to pop a link in the description below, so if you want to have a little bit more information about what it is, what we can do to help with it, things like that, check it out. That'll be a little bit more in depth. When you come in, what we treat most of the time would be things like swelling. So if you just had an injury, just rolled your ankle and your ankle swells up, we'd be reducing the swelling for that. Or for example, something like post-surgery, like you've just had a knee replacement or hip replacement and you're getting swelling around that, we can reduce the swelling. The other thing we treat is something called lymphedema. Usually when there's been either surgery or injury, you can get swelling in your leg or your arm. So usually people that have lymphedema know a little bit more about it. But what we do here is help to manually push lymph fluid back up so that we get rid of that swelling. So again, there's more information in that document that I'll post for you, but I thought I'd show you a little bit on how we would treat that as well for anybody that hasn't had manual lymph drainage. So it's a little bit different to a typical remedial massage that you would come in and get, because it's quite a soft touch. So normally we'd use a fair amount of pressure to get some knots out when you came in for a remedial massage, but for the manual lymph drainage it's quite a light touch. So essentially it's quite a soft dragging kind of motion, because your lymph nodes and vessels, they sit just below the surface of the skin. It means that we don't want to push too hard, otherwise we sort of push past those vessels. So it's quite a soft touch moving back up. For example, if I had lymphedema in this arm, we'd be pushing that fluid back up, and then things like redirecting it to other areas. So instead of going to a group of nodes that are under your arm, we can move them across to the other arm or down to the hip or groin, things like that. So like I said, check out the document if you want to have a little bit more information, or give us a call and I can have a chat to you if you've got any particular questions, or if you have anything that sounds like this and you want to find out a little bit more about our treatment, give us a buzz and hopefully we can help you out. But I hope you find that information a little interesting and informative. So give us a buzz if you need. Thanks, we'll see you later.